Luigi Mangione has been arrested in connection with the fatal shooting of Brian Thompson, the CEO of UnitedHealthCare. The incident occurred on December the 4th outside a New York City hotel where Thompson was attending a corporate investors conference. Authorities believe Mangione deliberately targeted Thompson, waiting for him to arrive before opening fire and fleeing the scene on a bike. Welcome, I'm Mark, and if this is your first time here, well, you picked a doozy. This was not going to be the next video that I was going to make, but the surprising public reaction to this shooting incident got my attention, and I felt like I needed to process it, to talk about it, and hopefully get some feedback from you about how you're feeling about this as well. So, Luigi Mangione allegedly kills a man in cold blood, CEO of a healthcare company, and what's happening now is that people are treating him as a kind of folk hero, cheering for him, rooting for him. America so hates its healthcare system that its citizens actually support murdering a healthcare executive in retribution. Yet, when Americans are asked if they want a universal healthcare in the United States similar to a European system, they balk. No way. I don't want government involved in my healthcare. So, why do Americans hate the current healthcare system so much that they applaud murder, yet they resist any substantive change to it? The celebration of Luigi Mangione by some individuals reflects widespread frustration with the U.S. healthcare system, which many see as exploitative and profit-driven. Health insurers, in particular, are often demonized for prioritizing shareholder profit over patient care, resulting in anger that may sometimes manifest as extreme support for violent acts like this one. However, this widespread disdain does not always translate into a desire for systemic change. Why? Several factors might explain this contradiction. Many Americans are skeptical of government-run programs. Decades of rhetoric portraying the government involvement as inefficient or restrictive make people resistant to even thinking about a European-style universal healthcare system. Healthcare is deeply personal, and people worry about disruptions to their existing coverage. The complexity of transitioning to a new system and uncertainty about outcomes contribute greatly to this fear. Opposition to universal healthcare is fueled by misinformation campaigns, which label such systems as socialist or rationing care. These arguments often play on cultural fears, influencing public opinion. American culture tends to emphasize individual autonomy. Universal healthcare, which relies on collective contributions, conflicts with this ethos. While Americans may dislike the current system, many don't see a clear, workable alternative being presented. Proposals for reform often lack widespread bipartisan support, making change feel unattainable. And there is no doubt that money has co-opted and corrupted the American system to such a vast extent that making any change becomes a monumental undertaking. The support for Mangione demonstrates a visceral, emotional response to the perceived injustice of our system, but it doesn't necessarily equate to rational policy preferences. It's easier to express anger toward a symbol, the CEO, than to endorse complex policy changes with uncertain impacts. This highlights a societal struggle. Americans want a healthcare system that works for them, but are caught between their dissatisfaction and their deeply ingrained cultural and political barriers to change. We're left with this idea that there are just two choices, the system that we have or the system in Europe, which people in the US fear because of their deep distrust of the government and preference for individual choice. But here's the thing. Many European countries with universal healthcare systems also maintain private healthcare options, offering a blend of public and private services. This creates flexibility and choice for patients, which could address one of the main concerns that Americans have about adopting similar systems. Private healthcare exists alongside the public system for those who want additional services, faster care, or access to private facilities. For example, in Germany, citizens can opt for private insurance if their income exceeds certain thresholds. In France, most residents have supplementary private insurance for added services like private hospital rooms. In Sweden, private providers work within the publicly funded system, offering choice while ensuring universal access. In these systems, universal healthcare guarantees a baseline level of care for everyone, while private healthcare provides more tailored or expedited services for those willing to pay for it. And hey, guess what? That's how America's public-private universal healthcare system for its senior citizens works as well. Medicare provides base coverages, and seniors can add Medicare Advantage or Medicare supplemental plans for additional coverages customized for their particular needs and their ability to pay. But the American debate often frames universal healthcare as an all or nothing shift, ignoring the coexistence of public and private options. Look, the European systems aren't and will never be perfect. There are definitely struggles in European nations with funding and with adequate staffing levels. But we don't have to look to Europe for solutions. We have an American system that, again, while not perfect, has proven hybrid systems can work. Rather than violent acts that only deepen societal divides, addressing healthcare inequities requires education, advocacy, and engagement in policymaking, none of which is very thrilling or sexy. We don't necessarily need to dump all private insurance companies, but we do need to make sure that insurers aren't making decisions on patient care. Leave that to the doctors where it belongs. The contrast between the visceral reactions in America and the lack of substantive debate on issues like healthcare reform is stark. Acts of violence, like the shooting of the UnitedHealthCare CEO, reflect deep anger and frustration, but do little to address our systemic problems or create meaningful change. We can't solve all of our problems in America by shooting one another.